I want to thank the women healthcare executives for this award. When Pamela and Shasta came to Mountain View, they had told me that Jillian Springer, my friend at CPMC, had nominated me. And I was so pleased to be nominated, and I had no idea that I had won for the entire meeting when we were talking about this hypothetical situation, and I think I actually started crying when you told me. It's such an honor to be here tonight. I can't even express it. I want to also thank my family and friends who are here, some of whom traveled a great distance, and of course my Alzheimer's Association colleagues, our volunteers. Our volunteers, our present and past board members, you are an amazing group of people. I'd also like to do a special shout out to my friends at CPMC and the Brain Health Center, Dr. Catherine Madison. And also Mrs. Dagmar Dolby. Two more amazing, innovative, incredible women you will not meet. So thank you all for being here. When I think back to 18 years ago, so I've been with the association for 18 years, and I was just fresh out of my postdoctoral fellowship at the VA in Palo Alto, and I reflected on my career, I can honestly say it didn't even occur to me that I would be working for the Alzheimer's Association. When I envisioned my career, I was going to be a clinical psychologist, working with older adults who were depressed and anxious, dealing with fear, or maybe even subjecting them to endless hours of neuropsychological testing. I actually really enjoyed that at the time. But there was this position open at the Alzheimer's Association to be program director, and it was pretty small back then. There were just a handful of program staff. And I thought, well, I could do this for 2 years and get some management experience and create some new programs and evaluate them and help people around Alzheimer's. I had experience with Alzheimer's. And a funny thing happened. After those 2 years were up, I stayed, and then 18 years later, here I am, right? I found my mission in life at the Alzheimer's Association. Helping people with Alzheimer's is incredibly fulfilling. The idea of helping someone through what might be some of their darkest moments and making that a little bit easier, you can't really beat that. So here I am, trying to have an impact. Sometimes people will ask me if it's depressing to work with people with Alzheimer's, and actually, no. It's not to say it's not sad sometimes, but for me, it's so rewarding. Jeff just mentioned our vision is to create a world without Alzheimer's and improve quality of life for people who are living with it now. Again, it doesn't get better than that in terms of moving our whole society forward. Tonight, I wanted to share with you some of the lessons and some of the stories that stick in my mind when I reflect about the last 18 years. But first, I did want to start with a short little video. Each year, the Alzheimer's Association does a report called Facts and Figures. And they produce then a quick little 90-second video to give you a sense of how many people are affected. And since this isn't necessarily your field, I thought I'd share in 90 seconds, what are we facing right now? Those statistics are certainly staggering. They're even more so with music, trust me. So, everything was tempted to go boom, 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 boom. So the statistics aside, when I reflect on my work with people with Alzheimer's, I certainly do think about the impact I've had locally when we look at the thousands of families we work with, or statewide trying to influence quality of care, or even nationally, as Jeff mentioned. But I do tend to come back to the individuals and the stories of individuals with whom I've worked. And so that's what I hope to share with you a bit tonight, are some of the poignant and some of the funny experiences I've had. So the first lesson that I learned in my work with the Alzheimer's Association is there is laughter among the tears. Granted, Alzheimer's can be a sad disease, as I mentioned, but if you had the opportunity to come to any one of our offices and stand outside the group room where we have our early stage patient support group meeting, you would think there was a party going on in there. The laughter that comes out of that room on a regular basis really helps you see the strength that people pull from one another when going through a really difficult time. And as that door opens up, there's all these hugs and kisses and laughs, and you wouldn't even know that the people coming out have Alzheimer's in most instances. And that's what I see a lot, is people coming together and sharing joy. There's one story that my colleague Becky in Chico shared, and this was a group that she was doing that actually was people with Alzheimer's that was a little more advanced. And it was 8 women with what we would describe as middle stage Alzheimer's. And in the group that Becky was running, they were talking about the merits of the Three Stooges in that group. And I don't know about you, but I don't really get the Three Stooges. I have never understood the appeal, right? Well, neither can Becky. So Becky said to the group, she said, I don't get it. Why does anybody like the Three Stooges? I don't like the Three Stooges. And they talked about this, and some of the women in the group laughed, but the woman next to her leaned over and said, oh no, that's terrible. They always speak so fondly of you. Started laughing, so did she. The second lesson I have is that it's very important to be humble about one's memory functioning. Yes, I can hear some. And what I mean by that is, so when I started working for the Alzheimer's Association, I was 28 years old, and so memory challenges were a couple of years down the road, right? But I initiated a program called Maximizing Your Memory. And it's a memory on how to find your car keys, where did you park your car, you know, all those important things. So it's memory tips, and we slip in a little bit of information about Alzheimer's, right? And what we learned is that if we do an Alzheimer's talk, we might get 20 people. If we do a talk on how to improve your memory, we can get 100 people or even 200 people. And then we just slip in a little bit about what are red flags that you might want to talk to your doctor about. So I started practicing the principles that I was teaching. And one of those things that I taught was using associations to help remember things. Some of you probably do this too, right? Well, so I had an experience. I was working with a facility in the South Bay. They were having some difficulties around the quality of care that they were providing. And so the administrator there, Michelle, and I were working together extensively over a year. And so I would call up the facility, and I would say, hi, I'm calling for Michelle Brown. And I thought, this is great, it's a caller. I can remember Michelle's last name because it's a caller, right? So I would call up and I'd say, is Michelle Brown there? And the receptionist would pause, And she'd say, I'm sorry, who? And I'd say, Michelle Brown, you know, the administrator. She runs the facility, Michelle. And they go, oh, Michelle, oh, okay. So this happened repeatedly. Then one day, I went in person, and I asked for Michelle Brown. Again, the association, you know, it's a color, I'm really good at this. And so, this is the front desk person said, I'm sorry, what are you talking about? I said, Michelle, the administrator. They go, oh, Michelle. So Michelle comes out, and she shakes my hand. Elizabeth, it's really great to see you. I have to tell you something. She said, my name is not Michelle Brown, it's Michelle White. And I said, oh, Michelle, I thought I was so smart. I was using this association. And she said, oh, don't worry about it. Whenever I have a new person on the front desk, I tell them if anyone calls for Michelle Brown, it's Elizabeth from the Alzheimer and she means me.
That's good. That is good.
Can you relate to that at all? Tell me I'm not alone. I tell these stories when I do Maximizing Your Memory classes, and I have a parade of elderly women saying, you made me feel so much better. I have a lot more stories. Lesson number 3. Sometimes you end up being known for things that you never dreamed of. In my case, I am the love, sex, and Alzheimer's expert. Now, I did not plan on that.
Is it the web?
I was called by our Reno office and asked if I would do the keynote address on sexuality and intimacy. And I thought, well, while I was at the VA, I trained actually in a sexual disorders clinic. And so I had some experience in working with people around sexuality and intimacy. And I thought, well, maybe I can do this. I'll research it. And what I found is there was nothing, almost nothing out there. And I'd never heard anyone do this presentation. But I thought, well, let's do it. So I did the keynote address on love, sex, and Alzheimer's. And let me share something. When you become known of as the love, sex, and Alzheimer's person, people send you cartoons. And this is one. I hope you can read it. I'll read it for you if you can't see it. The gentleman said, whatever happened to our sexual relations? And she says, I don't know, I don't even think we got a Christmas card. I love the looks on their faces. So, how did the love, sex, and Alzheimer's thing go? Well, so first year it went fine. They invited me back the next year. Okay, all right, I did it again. It went well. They invited me the next year, the same place, Reno, every year, love, sex, and Alzheimer's. I thought, what is going on here, people? So, here's what was going on. The legal guardians, so the people who have decision-making responsibilities for people with Alzheimer's in the Reno area are called the legal guardians. So they have conservatorship. The state of Nevada has conservatorship over them, and they appoint these individuals. Well, the legal guardians crowded into the room. It was really quite interesting to see how many of them were to come and hear the presentation. And what they said is, we have a lot of old cowboys and strippers on the dementia unit. And they want to hook up. So I researched that.
It's amazing.
Surprisingly found some guidelines. So let me describe the situation. In this case, it was 2 individuals. It was Joe and Kelly, and they wanted to have a romantic relationship, and they lived on the dementia unit. And so I found some guidelines, believe it or not, there are guidelines that have been written and published about how does the state of Nevada decide whether or not these two people with dementia can have a relationship on the dementia unit. Well, they went through the paperwork, they determined they had the capacity to make that decision, that they could and would say no if ever things weren't comfortable for them. And so they filed the paperwork, and lo and behold, Joe and Kelly could have a relationship. So it went beautifully, and I was asked back the next year. I thought, come on, people. I can speak on other topics here. They said, no, they really asked for you. All right, okay, so I went, and they said, okay, so it went really well. You should see Joe and Kelly. They're adorable. They're so affectionate with one another. Their lives are so improved. They're so affectionate and so happy that the other residents on the dementia unit really would like to get in on that action. And we've now received 8 separate individual requests to participate in sexual relationships. So what do we do with that? And I said, only in Reno am I asked, how do you determine if a person with dementia can consent to an orgy on the dementia unit? I said, this is beyond my capacity. You do get known for some unusual things. So the last lesson that I've learned is that the best strategies for caring for someone with Alzheimer's are often not found in a book. I have learned more from caregivers going through this journey than I've ever learned by reading. But sometimes I think we professionals, myself included, think that we know most of the answers, and maybe we don't. It is so different when it's your mom or your dad or your husband or wife or partner than if it's someone you know professionally. I see a lot of heads nodding, so you know what I'm talking about. One of my favorite stories was a woman who came to a group. I was doing a class on how to handle challenging behaviors. And she described a situation that was concerning. Her husband was becoming aggressive, and he'd get very angry and he would hit her. That's serious stuff, right? So I said, well, what do you do? Can you figure out what's triggering it? She said, sometimes I can, but sometimes I can't. But one day I came up with a new approach. She said, he was in the recliner and I could see him getting really tense and angry and his voice was changing. And she said, I went up to him and I grabbed his face in both my hands and I showered him with kisses. And I stopped. And I said, what happened? And she said, he opened his eyes up and he had the biggest smile on his face. You're never going to read that in a book. And I would be afraid to tell somebody to do it because I'd be afraid they'd get hit, right? But think about yourself. If you have dementia and you're having a bad day, it's probably pretty likely that someone you love showering you with kisses is going to play out of it. I have another story to share, actually, from someone in the room. Lori is a volunteer and has been on our program committee and other committees, and her husband Joe is on our board. And one day at our program committee, Lori came in and said, I have to share this story with you. And I'm so grateful to her that she told me this story because I tell it all the time. And what it was, Lori described that she was a caregiver for her mom for many years, and she shared that responsibility with her sisters. She comes from a big family. And she said, at Christmas time we were together, and I was next to my mom and my sisters were across the way. And my mom seemed a little confused, and I just leaned over and I pointed to my oldest sister and I said, do you know who she is? What's her name? And her mom said, I don't know. I don't know who that is. And then Lori pointed to her other sister and said, well, what about her? Do you know her name? And she said, no, I don't. I'm sorry. And then Lori told me, she said, I think maybe I had a little too much wine, but I did it. I asked the question that you really don't want to ask. I asked my mom, do you know who I am? Do you know what my name is? And my mom said, no, I'm sorry, I don't know who you are. And Lori said, I started to cry. It was so upsetting. And my mom reached over and gave me a big hug and said, oh, it's okay, honey. I'll know you tomorrow. And Lori shared that story with me and said, I want you to tell that so nobody ever does that. And I have told that so many times, because when you're dealing with Alzheimer's and dementia, quizzing the person you love about whether or not they know you is not going to always end in a happy ending, just by nature of the disease. So spare yourself and your mom. And I also love that her mom is still maternal, saying, it's okay. It speaks to how deep that is in her core. So the last story I have for you tonight is one that was shared in our early stage groups. And this was told by a caregiver of her husband has early stage Alzheimer's. And she said they were just arguing all day. Bicker, bicker, bicker. And she said it was a horrible day. We just couldn't agree on anything. We're yelling, and it was awful. And she said, I need to get out of here. She was in the kitchen. She went out the back door into the yard and just took a break, which is actually one of the things you do read in the book, right? Go take a break when you need to. So she walked outside, and it was nighttime. She said, we've been arguing all day long. And she looked out, and it was a clear night, and the stars were out. And it was kind of cool, and she took a deep breath, and it was just refreshing and beautiful. And she looked up at the stars, and she thought, I don't even know what we were arguing about. Why am I doing this? In case you don't know, you can't actually win an argument with a person with Alzheimer's. And she reminded herself of that. You can't win. Why am I doing this? What difference does this make? I need to stop this. So she spent a few more minutes, regrouped, went back in the kitchen, and her husband was there at the door and said, oh, thank God, where have you been? I've been looking everywhere for you. He said, there's been this total bitch here. Oh, thank God you're back. So on that note, and thank you again so much for this incredible honor. I can't tell you how much it means to me. Thank you to the Women Healthcare Executives. You're an incredible group, and thank you all for being here tonight.